Block 5, demonstrating empathy. You respond when a patient demonstrates an emotion. This month, we want to teach you how you can respond with empathy. There are many things you can do or say when a patient demonstrates an emotion. Let's focus on our body language first. What are things we do with our body when a patient demonstrates an emotion? You would pause, change your posture, change your facial expression, stop what you're doing, and turn towards the patient to make eye contact. Change your tone of voice. Close in the space between you and the patient. You want to avoid body language that might indicate lack of empathy, like folding your arms across your chest, lacking any sort of eye contact, or showing signs that you're trying to get out of the room, like putting your hand on the door handle. Touch can be a powerful, nonverbal form of communication if used appropriately. What can we say to our patients when they demonstrate an emotion? At Loyola, we encourage you to use the nursing mnemonic. NURSE stands for naming the emotion, demonstrating understanding, showing respect and support, NURS. Nursing an emotion is a quartet of statements that you can say in response to an emotion demonstrated by a patient. This helps to acknowledge the emotion and move on with your encounter with the patient. Here are some sample nursing statements. Remember, responding with empathy doesn't take time. This is example number 1. So that makes you feel sad. I can appreciate how you would feel that way. You've been through a lot. Let's get to the bottom of this together and see what we can do. Example 2 of a nursing statement. You seem frustrated as you tell me this. I can see how it make you feel frustrated. Thank you for sharing this with me. I want you to know that I am here to support you. Again, a nursing statement is a quartet of statements that you can say when a patient has demonstrated some sort of emotion to acknowledge how they are feeling, and it allows you to move on with your conversation and push the agenda forward to complete your encounter with a satisfied patient. There are many sample nursing statements that we can use. You will be provided a pocket card to keep with you to utilize as a resource to use nursing statements with your patients. Remember, nursing emotions is not only for patients. This is a life skill and can be utilized on family members, colleagues, and friends. Remember that every patient has an emotion. We see a patient in their weakest moment. Our daily routine is a patient's life-changing event. A physician with empathy is one who realizes that every patient that walks into their room has an emotion. A good communicator will know what to say when a patient demonstrates that emotion. The best physicians know how to pull that emotion out from the patient. What are some things we can say to help pull out an emotion from a patient? You can ask them questions like, how is this going for you? How are you dealing with all of this emotionally? You seem really sad as you tell me this. I think if that happened to me, I might feel really upset too. I can imagine that this could be frustrating for you. Cue into the emotion. Pull that emotion out onto the table and then nurse that emotion. Once a patient admits that they are feeling sad or frustrated or angry or upset, ask them to tell you more about feeling sad, angry, frustrated, or upset, And then take the opportunity to use your quartet of statements, your nursing statement, which only takes a few seconds, to nurse their emotion. Go ahead. This month, show some empathy. It will make you feel great, and I know you can do it.